Washing your hands and not touching your mouth and your nose and your eyes.
The common sense of washing your hands, not touching your face.
Traditional rules of public health apply here. Just be smart.
Today, start working on not touching your face because viruses spread is when you touch your own mouth, nose, or eyes.
I've been looking around the room here. I can't tell you the number of you who've put your hands to your face in the last 20 minutes or half an hour.
Listen well, brother.
You have 15 people, and the 15 within a couple of days is going to be down to close to zero. We're going down, not up. We're going very substantially down, not up. I really think, Doctor, you want to treat this like you treat the flu, right? And, you know, it's going to be fine. Looks like by April, you know, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true. It's going to disappear. One day, it's like a miracle. It will disappear. Sure. As the disease spreads, if it spreads.
It's not so much a question of if this will happen anymore.
We're rapidly developing a vaccine.
We can't rely on a vaccine.
This will end. This will end.
This coronavirus will go well beyond this season into next season.
We have it so well under control.
It's likely that this virus will cause a pandemic.
I have to get off this one.
The Obama administration made a decision on testing that turned out to be very detrimental to what we're doing, and we undid that decision a few days ago so that the testing can take place in a much more accurate and rapid fashion.
We have a report today, the global death rate at 3.4%. Your reaction to that?
Well, I think the 3.4% is really a false number. Now, this is just my hunch. I think that number is very high. I think the number, personally, I would say the number is way under 1%. A lot of people will have this, and it's very mild. They'll get better very rapidly. They don't even see a doctor. They don't even call a doctor. You never hear about those people. So if, you know, we have thousands or hundreds of thousands of people that get better just by, you know, sitting around and even going to work, some of them go to work, but they get better. You can't put them down in the category of the overall population in terms of this corona flu.
Jesus. The corona flu, not only is he lying, he's making up new diseases now.
I like the numbers being where they are. I don't need to have the numbers double because of one ship. That wasn't our fault.
Dr. Steve Monroe.
Well, I think first I want to thank you for your decisive leadership in helping us, you know, put public health first. I think that's the most important thing I want to say.
I choose to run toward my problems and not away from them.
That's what.
President Trump's tips to avoid the coronavirus. Avoid close contact with other people. Stay away from anyone with a cough.
Let's do that over. He's coughing in the middle of my answer.
Yeah, okay.
I don't like that, you know?
Then your chief of staff.
If you're going to cough, please leave the room.
And don't shake hands with anyone who just traveled abroad.
There's no need for concern. What you need to...
Get out of here! Drive-through coronavirus testing. This is a free service that the city of Guyong is offering anybody, and then the results will come in within 2 to 3 days. This could be a model for countries like the U.S. that are just starting to deal with their first coronavirus cases.
Of course it should be a model for us. Look, we might be bad at stuff like healthcare, education, gun control, climate change, housing, criminal justice, and gender equality, but nobody is better than us at drive-thrus. I mean, come on. And nothing should appeal to our president more than treating healthcare like fast food. All we have to do is put coronavirus testing on the menu at every Wendy's, and he'd go get one himself.
A big and tasty for just $1? How do you do it? What's your secret? It's wrong, isn't it?
But it feels so right.
Then it's a deal?
Yes, we eat our pizza the wrong way.
Thrust first.
So I think it will help to accelerate the return of jobs to North America, some to U.S., probably some to Mexico as well.
I asked for 2.5, and I got 8.3, and I'll take it.
Roughly about 1.5 million tests that have gone out to hospitals.
Don't tell us things that are not true.
1,500 patients have been tested just at CDC. Meanwhile, Bloomberg News reported that in a short space of time, South Korea has managed to test more than 140,000 people.
I am awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered the test. The national CDC would not initiate the test.
뭔지 연합예배 시작하고 제일 많이 모였습니다. 제일 많이 모였습니다. 지금 기록을 세웠습니다. 기록을. 뭐 여기 오면 전혀 병이 안 걸린다. 그건 아니죠. 혹시 전염이 될 수도 있겠죠. 그래도 필요 없어요. 우리는 병 걸려 죽어도 괜찮아. 우리는 목적이 죽는 거예요. 목적이 죽는 거. 하늘나라가 확보된 사람이요. 바이러스 걸린 사람이 있습니까? 다음 주에 다 예배 오십시오. 예배. 주님이 다 고쳐주실 것입니다.
在脏乱差的环境下长大的印度人本身就自带超强的免疫力。
恒河水治百病了解一下。
我们胜利了吗？到了庆祝的时候了吗？不到。
But this is the time to be responsible.
The entire region of Lombardy, home to the financial capital Milan, is under lockdown.
Hey, stop!
All travellers who have been in mainland China will be banned from coming here unless they're New Zealanders.
So this is someone who has travelled to New Zealand earlier in the week and has come from Iran.
Cases and more than a dozen deaths. The Lithuanian government said that the country's first COVID-19 patient is a 39-year-old woman. She returned to Lithuania this week from Italy's northern city of Verona.